Il colpevole non è la vittima. Sorry to my Italian friends. I'm trying to paraphrase my good friend Simone from Italy. We had some wine and a beautiful dinner, as you do, when we were there for our last visit. Simone and I discussed the concept of cause and effect in relation to MSK conditions like plantar heel pains. Simone burst forth with Il colpevole non è la vittima. And this roughly translates to the guilty is not the victim. I know, it sounds better in Italian. So, what does that mean for plantar heel pains? It means the victim, the plantar fascia, or the plantar enthesis, isn't the guilty one. Or as we'd say in English, it isn't the cause of the problem. If you're interested in discovering the true cause of plantar heel pains, then welcome, you're in the right place. This video is for you. G'day, I'm Jedynak, international educator and health practitioner with over 30 years clinical experience treating MSK conditions of the foot, ankle, and the lower limb. I help foot fixers, podiatrists, physios, chiros, osteopaths, and other physical therapists take their skills to the next level so they can get the clinical breakthroughs their plantar heel pain patients expect. I'll take you through step by step through the quagmire that surrounds this tricky condition to save you a heap of headaches. I've sure had my fair share of headaches. Now, when I graduated in 1982, I thought the root theory was the holy grail of biomechanics. Fortunately, I wasn't Indiana Jones and the Holy Grail. Remember that movie? When it came to the Holy Grail of biomechanics, I chose poorly, and that left me as good as dead when it came to treating plantar heel pains. I thought the plantar fascia was a tensile traction injury caused by pes planus and excessive pronation. I didn't know that the plantar fascia was almost completely avascular and that there was no histological evidence to support the notion of the plantar fascia getting inflamed. Now we know that the evidence tells us it's the enthesis causing our patients the grief. But then there are 47 potential causes of plantar heel pain, so accurate diagnosis can be pretty tricky. And without an accurate diagnosis, what chance do us foot fixers have of achieving excellent treatment outcomes? And I promise that what you discover in this blog will also be super practical, so you can use it in your clinic straight away. I tell you, I would have killed for this information much earlier in my career. Today, we're going to drill down into an assessment technique for plantar heel pains that rarely, if ever, gets taught to podiatrists and other foot fixers. Certainly not in their undergraduate university training. And that's because this assessment process comes from physical therapy professions like physiotherapy and osteopathy. You know, to find the answers I needed to fix more plantar heel pain patients, I spent a considerable amount of time, energy, and money learning from some of the best brains in the business. And many of those brains were physios, chiros, and osteopaths. I've distilled decades of learning from a combination of health professions, even dentistry. In effect, these plantar heel pain blogs are the result of a multidisciplinary approach that's been tried and tested at the coalface of my own clinics as well as of my students around the world. So strap yourself in, because here comes one of the most important assessment tests you can do for plantar heel pains. Are you ready? Of course you are. So this is it. The most important assessment test you can do for plantar heel pains is not touch the plantar fascia. What? Not touch the plantar fascia? Yes, you heard me right. To give you some context, let me cover some key biomechanical and physiological elements that are not really well understood that well in podiatry, but are certainly well acknowledged in physiotherapy, osteopathy, and chiropractic, and other manual therapies. And that is, our bodies, every tissue, organ, connective tissue structure is wrapped up in a lining known as fascia. The MSK structures you're dealing with in your clinics are all enveloped in this web that fully connects to every other part of the body. It's a bit like when you buy a bag of oranges. You have a bag and it's that plastic netting, and as you pull on one part of the bag, you can't move one part without another part being affected to some degree. Now, you've heard the term kinetic chain. The myofascia plays a crucial role in transmitting forces and feedback up and down the kinetic chain. There's a specific anatomy train that connects the plantar fascia to the skull via the calf, hamstrings, and spinal structures. We're going to assess this myofascial network, the superficial back line, that connects into the plantar fascia. When we consider the myofascial anatomy and the networks, the site of pain or symptoms is rarely the site of fascial densities or compensations. In other words, il colpevole non è la vittima. The guilty is not the victim. Yes, this concept messed with my head too, but luckily it didn't mess with my hair. You may beg to differ. When we apply this thinking to plantar heel pain, the victim, or the effect if you like, is the plantar heel pain area. The guilty or the cause is often somewhere else. Have you ever heard of trigger points in the calf causing plantar heel pains? Acupuncturists are well known for relieving plantar heel pains by releasing the trigger points or needling the trigger points in the gastrocnemius muscle, in the bellies of the muscle. It's almost like when you hit your funny bone and you feel the zing go down your arm into your hand. That's a referred pain, the victim. And it's coming from the guilty, the ulnar nerve in the elbow. Okay, so here's the myofascial test that's done using a fascial release tool like this. First, the diagnostic strokes are applied along the superficial backline through the Achilles, calf muscles and hamstrings. Then any fascial densities identified in these regions are treated using the fascial release tool. The whole scanning and treatment process can take up to 5 to 7 minutes in total. Then the patient is released and reviewed 3 or 4 days' time. Now, if their plantar heel pain has noticeably improved by releasing those fascial densities, what's that assessment test telling you? It's telling you that their plantar heel pain cause is coming from a myofascial compensation higher up the kinetic chain, and that's what needs to be treated. Make sense? You bet! But here's the kicker. Around 50% of your MSK plantar heel pain patients are going to get noticeable improvements by releasing those fascial densities in their calf and hamstrings. And you didn't even touch the plantar fascia. Now, if you've done a tool-assisted fascial release training with me, you know exactly what I'm talking about. If you haven't done a tool-assisted fascial release training with me, let me make some recommendations for you to test this out for yourself. First, you'll need a steel tool of some sort. You could use a scalpel handle, but it's probably a little bit too light to be effective. Instead, get hold of a butter knife and then practice on yourself. Most of us will have fascial densities or compensations in our forearms. So try this. Place the tool with your hand on your index finger on top of the tool. This is going to be your sensor for fascial densities. It's kind of like the stylus of a record player picking up the music on a vinyl LP. Now you can run the knife over your muscles. You apply about 300 to 500 grams of force, and the handle will grab or jump on those fascial densities. Now, you'll feel two things. One is a heightened level of sensitivity in the densities, like your patients will feel that too, and the other is you'll feel that grab or restriction, and yet other areas are quite smooth. You can try this on different sites in your body and maybe even get some volunteers to practice on before you try it out on paying customers. But I've got to tell you, even if your palpation skills are not well developed, the tool or the knife, it amplifies the irregularities, and literally within 10 minutes of practice, you'll be amazed at what you can feel. If you only take one thing away from today's blog, it's this premise. The site of pain is the point of failure in the kinetic chain. It's rarely the cause of the problem, rather it's the effect. The cause is usually due to resistance or dysfunction elsewhere in the chain. Does this make sense? I sure hope so. In the past, my approach to treating plantar heel pains was typically, is this where it hurts? Okay, well that's where I'm going to treat. Unfortunately, I wasn't alone in this approach, and still to this day, many health practitioners think that this approach is effective. But you need to appreciate that the painful site is just an indicator that there's probably a problem elsewhere in the kinetic chain or in the myofascial chain. And the pain site is just the point of failure. I'll provide you with a link to a demonstration of the diagnostic scanning using fascial tools like this. The video is only available to students who have purchased our online tool-assisted fascial release course, so it's a very special freebie for you this week. I'll also include the link to the best fascial release tools, just in case you're interested in getting a high-quality steel tool like this at a remarkably good value price. I don't get any commission or spotter's fee, but the recommendation, if it saves you a heap of time and effort, well then I'm happy to do that for you. So in this blog, you discovered an assessment technique for plantar heel pains that rarely gets taught to podiatrists and other foot fixers. We also explored the importance of looking beyond the heel when assessing plantar heel pains. And we checked out this great tool, tool-assisted fascial release, which I wouldn't work without. Thanks for watching this video, and thanks for your interest in getting more predictable outcomes for plantar heel pains. It's truly inspiring to be with health practitioners who make it their mission to get the breakthroughs that help their patients like never before. Make sure you download the fabulous freebie on diagnostic scanning with fascial release tools. See you next week for more battle-tested plantar heel pain shortcuts. Ciao.